Okay, how do you address behavioral and psychological symptoms of dementia, such as agitation or depression? Right. So I think I briefly already spoke about this in one of the other questions. Like I said, now a lot of the symptoms that come along with dementia, such as agitation, depression, aggression, loss of appetite, difficulty with sleep, or excessive appetite, excessive sleep, wandering, repetition of whatever they're saying, shadowing, all of these symptoms are really not things that can be completely removed just through medicines pharmacologically. So they all require some non-pharmacological approaches and interventions to be done along with maybe a bit of medicine, a bit of pharmacy to help them cope better. So, for instance, if the person is suffering from a lot of aggression, then something to calm them down is definitely a good idea to get the doctor. So, me as a professional, I work with families where I would liaison with the neurologist and I would tell them, look, this is what is happening, because the family may not even know the vocabulary of dementia to be able to explain it to a doctor. So that's where we come in as psychologists, we explain it to the doctor, and the doctor then prescribes something to calm them down a little. Fair enough. The medication is given to the person, but apart from that, it's also important for us to determine what is actually aggravating this person. Is it just some chemical imbalance in the body, or maybe there's an environmental trigger, maybe there's something else going on? So this assessment of what is going on around the person, and therefore based on that what interventions need to be taken, is something that we do. So for any kind of behavioral or psychological problem, it's the same approach to try to understand what may be causing it, one, and secondly, what are the possible interventions that can be done to alleviate this disturbance as far as possible, and also lies on with the doctor, with the neurologist, to ensure that they're getting some kind of pharmacological help if needed for this situation. So it's a combination of all three: checking for the environmental factors, training the family or the attenders who are caring for the person on different kinds of interventions to deal with each of these issues, and thirdly, getting them the required medication that is required. And then, of course, a review after a few days to see how things are things better or worse? And if it is not getting better, then we do a whole revamp of the whole process to see what are we missing in the whole paradigm that is causing these issues. Because nobody acts up just like that. Nobody is just depressed, or I mean, when I say nobody is like that, nobody acts up just like that, I mean depression can occur in a person without having any kind of a like life circumstance or a major life trigger that is causing depression. A person can just be depressed because of chemical imbalances in the brain. But at the same time, it's important to remove any of the environmental triggers and anything that may be going on that is worsening the symptom. So yeah. So as a psychologist, my approach is to do it, to look at all of these factors.